Great. Welcome everyone to the next in our webinar series. Since 2023, we have been, as part of the U.S. Grade Network and Evidence Foundation, putting on a series of free webinars related to all things grade, guidelines, systematic review methodology, and evidence-based medicine. And this week, we are very honored to be joined by Emily Senerth for a discussion of the recent grade guidance on a new evidence to decision framework for environmental and occupational health guidelines. And as a quick reminder, you can follow us to stay aware of all of our events and information and research on our Facebook, our Twitter or X, and our Instagram. This webinar in particular is put on in partnership with World Evidence-Based Healthcare Day 2024. And so that is all of this week. There are events and blogs that you can go to access at worldebhcday.org. The theme of this year is from evidence to action. So we thought, what a better way than to spread the word and discuss our most recent guideline on our evidence decision framework, and specifically around guidelines and recommendations for environmental and occupational health. As a quick note, this is part of our fall series. I wanted to make everyone aware that we do have another upcoming webinar just in a couple weeks from now on Monday, November 4th at the same time. And this will be on integrating evidence from randomized and non-randomized studies in evidence syntheses and health guidelines. And this will be with Dr. Carlos Coelho Garcia. And so if you're interested, you can register for this upcoming webinar at the link here. I will also place the link in the chat. We'd love to see you there as well for more information and wonderful discussion around evidence syntheses and guidelines. Last but not least, this webinar will be recorded and put on our YouTube channel. So if you'd like to see any of our previous webinars that we have hosted, you can see this at our YouTube channel here at US Grade Net. And if there are any future webinars you're not able to join, but just to stay aware of all of the discussions we're having here, you can see them online. With that, I'm going to turn it over to my co-host and colleague, Rebecca Morgan, to introduce our guest speaker for today.
Great. Welcome, everybody. Such a nice turnout. Thanks for joining us. So my great pleasure to introduce Emily Senerth and her talk today. So Emily's a consultant with Evidence Foundation and comes with over 10 years of experience in the field of methods, right? So planning, coordinating, conducting, and implementing systematic reviews and guideline development. In addition to the clinical realm, in recent years, Emily has really expanded into topics of environmental and occupational health. And that's what you all get the pleasure of learning more about today. So she's really been spearheading a lot of the work around decision-making and grade for environmental and occupational health. Emily is currently the chair of the Working Group on Evidence and Decision-Making for the Evidence-Based Toxicology Center, collaboration at Johns Hopkins University, a member of the GRADE Working Group, again, leading several projects within the GRADE Environmental and Occupational Health Project Group, which you may want to join after this fantastic talk, and a contributor to the Guideline International Network, or GIN, Implementation Working Group and the Collaborations Working Group. So Emily, I do not want to take any more time away from what you have to present. I'm really looking forward to it. So thank you again for taking the time to be here.
Thanks, Rebecca. Thanks, Madeline. Okay, I'm going to go ahead and share my screen. I have been an attendee at several of these webinars, so it's kind of surreal to be on the other side and presenting, and very happy and honored to be invited to do so. As we mentioned in the intro, I'm going to be talking about moving from evidence to action and presenting a new framework for integrating systematic review evidence with additional considerations for decision making. So I will also note that this work was developed in collaboration with the GRADE Working Group, Evidence-Based Toxicology Collaboration, the US EPA, and the National Toxicology Program. So our agenda for the next 40 minutes or so, I'm going to talk a little bit about the extensive body of work by the GRADE Working Group and DECIDE collaboration that we're building on here, talk about why you might want to use a decision framework, and then give you an overview of how we developed this new evidence to decision framework, or ETD, and what exactly it contains. Then we'll work through some hypothetical examples to see how the framework might be applied to different types of decisions. And finally, I'll talk briefly about kind of what's next with this work. Although the topic area that I'm talking about here is environmental and occupational health, I think the process we use to create the new ETD framework, as well as kind of some of our findings, are broadly applicable to anyone who's using an ETD now in their guidelines work, or considering maybe applying the ETD framework in a new context. Okay, background. So the GRADE Evidence to Decision Framework, or ETD, was originally developed to support groups in making informed judgments about different healthcare options. The initial suite of ETD frameworks was published in and around 2016 through work that was really spearheaded by the DECIDE collaboration. Since 2016, the framework has been widely adopted in clinical and public health settings. It's designed to support organized and standardized consideration of decision factors, in addition to the effects of an intervention or an exposure. And the intended result is an evidence-informed recommendation or decision that's transparent and can be fully explained to stakeholders. Consistent with the GRADE approach, application of an ETD framework begins with a systematic review of a PICO or PECO question, as well as synthesis of those health effects into a GRADE evidence profile, including an assessment of the certainty of evidence for each outcome. However, benefits and harms are usually not the only factors that we consider when making a decision, particularly if that evidence is uncertain or the benefits and harms are very closely balanced. So the GRADE ETD framework is used to introduce additional considerations such as values, resource use, cost effectiveness, equity, acceptability, and feasibility to arrive at a decision. Why might you use something like the GRADE ETD framework? Through this project, we learned that there's really no prevailing framework to support decision-making in environmental and occupational health. We found kind of a patchwork of frameworks that have been developed for really specific scenarios that have poor generalizability beyond the exact situation they were developed for. So for example, a framework that's designed to make decisions about water management in developing countries is not applicable to a decision about installing a wind farm in the Midwest United States. This variability in approaches compromises the credibility, replicability, and uptake of subsequent decisions. So we hypothesized that the transparent combination of research evidence with these other considerations could be helpful as a foundational structure to support environmental health decision makers. However, the framework's not currently being used in environmental health. The GRADE approach to certainty assessment has been adopted by organizations such as WHO, the US EPA, and the NTP, as well as others, but the ETD framework has not. The decision types that were kind of included in the original scope of development of the ETD include population and individual patient level clinical decisions, population and individual decisions about diagnostic tests, healthcare coverage decisions, and health system and public health decisions. And these are all described in grade guidance papers. The existing ETDs, with the exception of diagnosis, follow kind of a similar structure. They provide an opportunity to specify the scope and context, which are the elements that define the conditions under which the decision is being made. And this includes the purpose of the decision, the perspective, target population or beneficiaries of the decision, all of the stakeholders who are going to be affected, the options that are under consideration, as well as implementation issues and any existing guidance. So within these parameters, decision makers compare the options using assessment criteria. Research evidence and the certainty in that evidence is used to inform these judgments, particularly about the benefits and harms or the consequences of different options, but may also be used to inform other judgments such as cost effectiveness, where there's research evidence available to inform them. Detailed judgments are questions within each assessment criterion that help decision makers to arrive at a judgment. They're sort of optional discussion prompts that you can use as a panel to really hone in on your judgment for each of the assessment criteria. So we wanted to see if this grade ETD structure would be applicable to environmental and occupational health and risk management decisions, including mitigation of environmental or occupational exposures, chemical alternatives assessment, site remediation and waste management, labeling of potential hazards or setting exposure thresholds, emergency management, and disaster response. These decisions may be made by regulators at different levels of government, such as local, state, and federal, by private companies, by professional organizations. So there really may be several different types of decision makers and different scenarios that may consider using the ETD framework. So our objective for the project was to explore the applicability of the ETD framework to some common environmental health decision scenarios. And next I'll talk about how we went about doing that and what we found. So prior studies have explored formulation of PECO questions for exposures. You may be familiar with the PICO format. There's also guidance on the ECO. Also developed an ROB instrument for non-randomized studies of exposures, or Robbins-E, assess the applicability of biological plausibility, and define an approach for assessing residual confounding. And all of this work can be found in a series in the journal Environment International. I've included a QR code that should take you directly to the landing page for all of these articles. I also want to mention our fantastic project team within the GRADE Environmental Health Project Group, as well as support from EBTC and participation by experts from the NTP and EPA. Could not have happened without them. So we did not assume that the ETD framework would be applicable to environmental health. We really conceptualized a project that should be able to detect any unique considerations that were being applied in environmental health decisions. So we have kind of a three-stage process. First, we conducted a systematic review and a narrative synthesis of published and public environmental health decision frameworks. Then we convened a panel of subject matter experts in environmental health to rate the considerations that were identified in the literature using a modified Delphi process. And finally, we conducted a workshop series to pilot test a provisional ETD framework for environmental health using an example decision scenario. The resulting guidance paper describing the ETD was approved by the GRADE Working Group last year. So now I'll just give you a little bit more detail on those methods. We started with our search of the gray and published literature for decision frameworks that were developed for or applied in environmental and occupational health. We conducted a thematic analysis of those decision considerations to explore their relationships to each other and also to concepts within the GRADE ETD. So, for example, if a framework mentioned reproductive toxicity, we identified an alignment with the GRADE ETD criteria addressing undesirable effects. When a framework suggested consideration of whether an option would be legally enforceable, we identified alignment with the ETD criterion addressing feasibility. Some of the concepts, like consideration of a fair distribution of benefits and burdens, were coded to multiple ETD criteria, in this case, equity and values. There was really no limit on the number of matches that could be made, just to make sure that we were taking the broadest possible interpretation of the frameworks in our sample. The modified Delphi process enabled us to elicit perspectives that are not represented in literature and helped us to hone in on key concepts that should be incorporated into the final framework. So we had 17 panelists and 2 rounds of rating both the relevance and the wording of the GRADE ETD components and the decision considerations from our literature search. From the systematic review, we identified 38 source frameworks that are being applied in environmental health, comprised of 560 individual decision considerations. Through the narrative synthesis and input from the panel, we narrowed this to a provisional ETD framework. The Delphi panel feedback really focused on clarifying areas where the provisional framework was confusing or difficult to apply, organizing the concepts and adapting the terminology and examples that were used in the framework for an environmental health audience. A key result from this phase of the project is that we didn't find any decision criteria or considerations that were not addressed by the GRADE ETD framework. So differences between frameworks that are being used in environmental health and the ETD, which is not, are really not about the content of the framework, but the way that content is presented. For the workshop series, we convened 2 workshops, one with the GRADE Environmental Health Project Group and one with decision makers from the US EPA. We had 21 participants in total, and we provided them with an abbreviated evidence profile and asked them to work through a facilitated ETD discussion to arrive at a decision. The example scenario that we used was a closure of a coal mine in West Virginia. So again, workshop participants were asked to identify if there were any concepts or considerations that were missing from our provisional framework, but none were identified. Feedback from the workshop helped us to organize the detailed judgments within each assessment criteria to make these more useful and applicable. The workshops also really highlighted the importance of providing guidance for the framework application, because our intended users are not familiar with this framework, and it's not necessarily going to be intuitive to apply. So the other thing we noted is that every decision maker or member of a panel doesn't have to be really super well versed in the ETD or in the methods, but an experienced facilitator can guide the panel through the framework application, and this is pretty important to make sure the application is consistent. Okay, so a summary of the tailoring that resulted from our project so far. Most of this was really focused on vocabulary as opposed to actually changing the meaning of the framework components. So for the scope and context section of the ETD, within the target population, an example of the kind of an existing example within that section was adults undergoing elective orthopedic surgery. And when environmental health decision makers saw this example, they were like, not only does this example not apply, but then they were questioning whether the entire framework could be applicable to their decision types. So we changed the kind of example for the target population to workers, industry, or society. And this is kind of an abbreviated version. That the actual framework has like a little bit more detail here. With the assessment criteria, although we didn't note any new assessment criteria for the ETD and also did not remove any, we broadened the equity criteria to more intuitively accommodate social and environmental justice by changing the term health equity to just equity. And again, we heard from environmental health decision makers that this environmental and social justice component is key for them to acknowledge in decision making, and they felt like it wasn't necessarily represented in the term health equity. Finally, the detailed judgments within each health criteria underwent tailoring. So for the desirable effects, we added the detailed judgment: how substantial is the time span for the intervention or exposure to reach full effectiveness? So this recognizes that in environmental health, decision makers may be weighing short-term against long-term consequences. So although they're considering the desirable effects, they might have kind of a specific lens through which they conceptualize that. Ultimately, this project really also served to validate the structure and content of the original ETDs, because we did not identify any necessary changes to the assessment criteria. Okay, to summarize here, the purpose of the scope and context criteria are to pre-specify the conditions under which the decision is taking place. That includes the purpose, perspective, the target population, key stakeholders, implementation issues, etc. Through the project, we learned that if any of these criteria are not addressed, ETD implementation may be challenging. So judgments about the assessment criteria are informed by the parameters identified during scoping. And skipping that scoping process is a barrier to use of the framework. For example, if decision makers get to the criteria around acceptability of the options to different stakeholders, it's difficult to answer that question if you have not pre-specified who your stakeholders are. And when people run into trouble answering those assessment questions, they may decide it's because the framework doesn't apply, when actually it's because they really just haven't clarified what the target of those assessment criteria is. Speaking of the assessment criteria, I'm just going to summarize here what they are in both the original ETD frameworks from 2016, as well as the new framework for environmental and occupational health. Priority of the problem, desirable and undesirable effects, values, balance of effects, resources required, cost effectiveness, equity, which has a little asterisk because we have broadened that equity criteria, and I think we can explore that more in the subsequent examples, acceptability, and feasibility. So again, these criteria are used to compare different options, taking into account both the evidence for the benefits and potential harms, but also considering other factors that weigh into that final decision. Throughout the process, we also identified opportunities to provide guidance for framework application, which is really a key resource for new users who haven't really had experience with the ETD before. This includes clarification of terminology, providing new examples that are relevant to different contexts, elaboration on the intended application of different response options for those assessment criteria, providing a process when there's more than one reasonable response to an assessment criteria, emphasis on that linkage between scoping and assessment, and kind of calling out different areas where the scoping process is really essential to answer the assessment question, And finally, process for when an individual criterion may be less applicable to a particular decision. And again, we will kind of come across that in the kind of subsequent examples. So I'm going to take you through 3 different examples. I'm not going to cover every assessment criteria for each example, but I've selected a few just to illustrate how the ETD framework can be applied in different situations and how these assessment criteria may impact a final decision. So first, we have an intervention scenario around polychlorinated biphenyls, or PCBs. PCBs were manufactured in the US from 1930 to 1979, when they were banned by the US EPA due to adverse health effects. Before that, they were used mostly in industrial applications as plasticizers and pigments, etc. As such, residual and inadvertent PCBs persist in the environment through this prior industrial use. We have a couple of different options for disposal of these residual substances, one being incineration and another being a landfill. This example actually came from one of the papers that we had in our sample of environmental health decision frameworks. So the citation for that is below on the slide. So how are we going to choose between incineration, our intervention, and landfill disposal, or the comparator? So is disposal of PCBs a priority? One thing we heard from kind of the Delphi panel, as well as kind of from our workshop participants, is that an issue is often assumed to be a priority once the decision-making process has started. So why even have this question? However, it can be really helpful when you're iteratively informing prioritization across multiple topics, when you're anticipating that a decision is going to be particularly controversial, or just to begin the process with kind of reflection on why you're going through, why you're undertaking a recommendation or a decision. These can all be helpful uses of this assessment question. In terms of the detailed judgments from the environmental health decision literature, we pulled several themes, including are the consequences severe, irreversible, or important? And I think the notion of irreversibility really speaks to kind of this core component of the precautionary principle, which we needed to clearly operationalize within the framework in order for it to have face validity to the end users. Is a situation urgent, emergent, or unprecedented? Is the issue a priority of the local political system or the national political system, which again can be really pertinent for regulators? And is the issue a priority for the local community? So PCBs were widely used in industrial settings prior to regulation, and the adverse health effects of PCBs are well established. So selection of an intervention for disposal of the harmful substance is a priority. Let's stipulate that and we can proceed. Okay, so we're talking about the desirable and undesirable effects of incineration of PCBs. And this is really critical to make sure it's clear for you and for the panel, because we're not talking about PCB exposure. We're talking about PCB incineration. So this intervention can have both desirable and undesirable effects. Although you could also apply this framework to exposure, which we will in the next scenario, in this case, we're thinking about desirable effects such as the effectiveness of incineration at disposing of PCBs versus the potential undesirable effects such as incineration, emissions from incineration. These effects may also accrue over different periods of time. So maybe emissions are more immediate, effectiveness is more long-term. So decision makers consider how closely the effects are balanced, as well as the certainty of evidence when making a decision. Okay, skipping forward a little bit, we can also talk about resources required for incineration of PCBs. And this criteria is intended to disaggregate the resource requirements for implementation. So what types of resources are relevant, and do we note direct costs or savings with our intervention? So direct costs may include personnel, material resources, the costs of operating the plant, compared to our alternative, which is landfill disposal. Comparatively large resource requirements may need to be addressed in the implementation of a decision. So concepts such as polluter pays aren't directly relevant to making judgments about the magnitude of resources, but may be important in that subsequent phase when you're thinking about who's responsible for paying for this. For cost effectiveness, this is where we think about net benefit and weighing our potential desirable effects against direct costs. So we may consider, for example, the cost per ton to adequately dispose of PCB waste via incineration versus the cost per ton to store in a landfill against the respective effectiveness of those two options at disposal. Okay, equity. Again, we've kind of disaggregated the equity assessment into detailed judgments to help decision makers think through how to answer questions about whether their options have an impact on equity and what that might be. So decision makers may consider, is there a differential impact due to baseline conditions? Is there a disproportionate impact across different groups? Would the intervention increase inequities experienced by marginalized members of the affected population? Would it increase inequality or the unequal distribution of benefits, harms, or representation? So in this case, decision makers might think about who's exposed to these incineration emissions, and where you might locate an incineration facility or a landfill, and where do these kind of undesirable sites usually end up located within their community, and who's bearing the burden of that. Ultimately, you may decide to make a recommendation or a decision that decreases equity, but you can demonstrate through the ETD that it has been considered, and then proactively note in your implementation strategy that you know this recommendation is going to have an effect on equity, and how can that be managed to whatever extent is possible. Okay, our next example is an exposure limit scenario involving ethylene oxide, or ETO. ETO is one of 188 hazardous air pollutants that are regulated by the EPA. It's used in commercial sterilization to decrease infection risk from medical equipment. In 2016, the EPA updated their IRIS value, indicating that ETO is carcinogenic to humans via inhalation. In 2023, EPA conducted an analysis to support proposed amendments to the current emissions standard. That source is noted on the slide, and all this background information is kind of available in the public domain. So we have a proposed amendment to an emission standard, which is essentially an exposure limit. So here we're thinking about desirable and undesirable effects of the exposure, and possibly of the exposure at different levels. So here, really, we can characterize the potential risks of ETO exposure as increased cancer risk. In terms of benefits, we might say there really aren't any benefits, or these benefits are trivial. And so again, something we noticed in working through example scenarios with environmental health decision makers is they get really hung up on, well, these exposures are harmful and they have no benefits. Therefore, this framework can't possibly be applicable. So it's important to kind of provide this guidance so that people know where to go when they hit a question where it might not apply. What we kind of illustrate through the guidance is that the potential benefits and harms of an option should be explicit, including documentation of factors that are inapplicable or unimportant to decision making, because this enables interested parties from outside the decision-making process to understand that that there was really comprehensive consideration of all the relevant factors, even if some of those factors were judged to be trivial or inapplicable. Again, we're going to talk about equity. So I'm not going to revisit the detailed judgments, but for this example, the EPA noted that ETO is considered a local pollutant, meaning that emissions carry greater risk for individuals who live or spend significant time near the emission sources. So we're thinking workers, we're thinking immediate geographical proximity to the sterilization plant. And a demographic analysis conducted by the EPA suggested that African Americans are disproportionately represented in areas with higher risk sterilization facilities. So this potentially represents a disproportionate impact across groups. And when you're thinking about setting the emission standard, it's important to consider kind of the variability in vulnerability across different groups in your constituency or in your target population. Okay, thinking about acceptability of the regulation of ETO. Who are the stakeholders? Have we pre-specified them during the scoping process? And then we can answer a question about whether the stakeholders find this different options about regulation acceptable. So here, our stakeholders include our target population or the population that's going to benefit from regulation of a harmful exposure. But we might also think about the operators of the plants, industry, government, and critically, the healthcare system that is using ETO for sterilization. And whether all of these stakeholder groups would view more stringent regulation as acceptable. We might note variability among stakeholders. The plant operator might say that they really aren't in a position to reduce the volume of emissions. And the healthcare system might say, we need that equipment sterilized, and we can't have any regulation that's going to potentially constrain the supply of sterile equipment to hospitals. However, people in the surrounding community obviously are going to say they don't want to be exposed to a carcinogenic substance. So that's variability in the acceptability of different options for regulation. What do we do with this in making a decision? It may impact the strength of your final recommendation. So if you notice that you have different stakeholder groups in the constituency that are all kind of on opposite sides of whether the option is acceptable, you might say, we're not going to like mandate this as a strong recommendation. It might be more conditional. Feasibility. Here we're thinking about capacity and infrastructure to implement the proposed regulation. So is the option sustainable? Is it sustainable for the relevant duration of time? And then also kind of newer for environmental and occupational health is thinking about the regulatory and legal landscape and the presence of barriers such as laws or regulations that limit or enable feasibility. So in this case, Section 112 of the Clean Air Act provides the legal authority for the proposed rule. However, a regulation with no enforcement mechanism may not be recommended, even if other criteria favor this option. Okay, last scenario, and here we're returning to our workshop example of an Appalachian coal mine. So if you were a regional government agency in Appalachia and you have a coal mine in your jurisdiction that is causing an increase in coal workers' pneumoconiosis or CWP and an increase in regional COPD, you need to make a decision about whether you're going to close this mine or allow it to continue to operate. However, when you're making this decision, you may also consider the quality of life of your local community and the impact on things like the general sort of employment rate and whether closing the plant is going to result in lost jobs. So talking about values here, unlike acceptability, with values, we're really thinking just about the target population or the intended beneficiary of the decision. So we're going to take our coal mine owner and operator out of it and just think about mine workers and the local community who are suffering from these health effects of the exposure to the coal dust. Even so, this question really asks us, do people in the target population have differing or uncertain values about the effects? For example, do they place different value on the possible consequences of mitigation of this exposure by closing the mine? We might note differences in values based on the proximity to the mine, whether someone works at the mine, a family of a worker, a geographically close community versus more distant from the mine. And in this case, it's really likely that opposing values may be present within our target population. This is a common situation in environmental health decision-making, where even when you are looking at who will benefit from your recommendation, they may not all have the same values about that option. Again, here it's really helpful to record the uncertainty or variability in the values, and again, account for that in the strength of the final recommendation. So again, when we think about the implications of a strong recommendation, it's that most people are going to want the option. And if there's big differences in values, that may not be the case. And we're coming back to equity again. So this was really kind of an example that helped us think through the broadening of that equity criteria to include health equity as well as social and economic conditions that kind of shape health through a more indirect path. So the burden of our decision on coal mine closure includes both health conditions like the CWP and COPD, and the social and economic conditions such as job loss, potentially leading to loss of health coverage, and stress that cause kind of downstream health consequences for the community as well. These social and economic conditions are actually pretty instrumental in shaping the health of the community. So this is kind of an example of why the term health equity may not have been interpreted to include all of the relevant considerations for equity as an assessment criteria. Okay, in summary, the GRADE ETD framework for environmental health is not very different from the pre-existing GRADE ETD frameworks or from what environmental health decision makers are already doing. It's really grounded in existing processes in environmental health, and as well as kind of the well-vetted work that was already done by the GRADE working group and the DECIDE collaboration. The framework is intended to be comprehensive, generalizable, and consistent across decisions. And ultimately, some criteria may not apply. You may not have any data on cost effectiveness. That's okay. The assessment criteria are really designed to prompt judgments that may otherwise be implicit or invisible. And then finally, there's no correct answer to these questions. The expertise and the judgment of the decision makers is really key to kind of determining the response to each criteria. Okay, challenges with implementation of the ETD in environmental health. First of all, this field has relatively recently adopted the grade approach to certainty. So there's not a lot of experience with using the grade ETD in the field. Importantly, there's a learning curve for any new user in any context when implementing a framework for the first time. And finally, an interesting kind of finding of our more qualitative work with environmental health decision makers is that there may be some hesitancy around making a process completely transparent, especially when a decision is anticipated to be highly controversial. What we would kind of pose in response is maybe transparency could actually improve the credibility of these super controversial decisions. Important limitations to note about our work. To this point, we've kind of engaged a limited sample of environmental health decision makers, just because this is a kind of a small sample of people to begin with. Our pilot testing was with hypothetical scenarios and also did not include the scope and context process. We sort of handed a scope and context to the decision makers in order to enable us to get the workshops done in a reasonable amount of time. And finally, some of our judgments about how to interpret and apply information throughout the project may be subjective. So where are we going from here? Both the systematic review and Delphi process and the grade guidance 40 on the framework are under peer review at the moment. However, both are available as preprints at the respective QR codes. If you'd like to check out kind of more about the development process, I would point you towards the systematic review. If you want to know just what is in the framework exactly, that's more the guidance paper. Additionally, we plan more user acceptance testing for 2025, including focus groups on approaches, challenges, and just culture of decision-making in environmental health to identify additional barriers and facilitators to framework application, and an actual framework application by a guideline panel in a real decision scenario. Also want to come back around to say that although the subject matter here is kind of superficially environmental and occupational health, what we've done, I think, around the process and the findings may be applicable to other projects that are going to explore the use and applicability of the ETD framework. So this is kind of a recent assessment of the ETD and our findings around the guidance for application of the framework and where the opportunities to provide guidance are, the areas where terminology and examples may be generalizable or not generalizable to different settings, and the consideration of equity across different contexts are all things that you may consider kind of as any new user of the ETD or someone who's looking to kind of expand the ETD into a new context. I'll end with just providing my contact information. If you're interested in this work, if you'd like to be involved with that subsequent user acceptance testing, please get in touch with me. And thank you for your time today.
Thank you so much, Emily. Wonderful job. So once again, if anyone has questions, you can either raise your hand, feel free to unmute, or if you'd like, you can put them in the chat. I think we do have a question from Hassan.
So I have two questions, but I'll just ask one in case, because there isn't a lot of time in case other people will ask questions. But Emily, the WHO also tried to develop some ETD. They called it WHO Integrate. And they did, I mean, looking at it, it's exactly the same result, that all the things they identified in terms of domains, they map back to the original ETD. So it resonates a lot with me that it's the same end results. Although they say these are new domains, but really they map back to the same original domain. Do you see some similarities with your work and the WHO Integrate? Because I think it's not a clinical context, so it's more closer probably.
Yep, that's a really good point. Thanks for asking about that, Hassan. The WHO Integrate was actually one of the frameworks in our sample. So we just doubly confirmed that the concepts in the Integrate kind of map back, as you said, to the original ETD. I think one reason we felt like this work was necessary, despite the existence of frameworks like Integrate, is that they're just not necessarily being used outside of the context in which, like, WHO may be using Integrate, but we did not find evidence, and someone can correct me if I'm wrong, that anyone else is using that for their environmental and occupational health decisions. So we really wanted to create something that really was developed under the auspices of the GRADE working group and also had that cross context generalizability.
I think maybe I could just add one thing to that. First, excellent talk, Emily. I thought that was just extremely clear and really highlighted all of the important points. The first example that you presented on PCBs, that is an intervention question, right? It's an intervention question. However, because of the framing within the environmental field, it was not felt that the conventional ETD would be appropriate to answer that. And I think that's really the crux of why this research is so important and why the tailoring of the conventional ETD is so valuable to the field. I think I just wanted to emphasize that point. It could absolutely be tackled by the conventional ETD. It's completely an intervention question, but somehow there's a barrier to it.
Yeah, I mean, really, the reason for my question to Emily was that I applaud your conclusion because it takes courage to say that, okay, well, this work maps to the original domains. But instead of trying to spin this and say, oh, this is a new domain. So I applaud that.
Thanks.
Like we have a question from Joy Keller. She asks, what are the lessons learned from your work that might inform or advance traditional applications of GRADE evidence to decision frameworks for health questions, especially for health areas or questions with scant evidence and or health experts new to the GRADE process?
Okay, thank you, Joy. I think you really kind of nailed what I was hoping for people to take away from this talk, which is that I think that this work does have applicability to other situations. I think it's, the original frameworks were developed in 2016. Obviously, this work mostly validates that structure, but there are opportunities to help the ETD be more accessible to new users, as well as to kind of maybe rethink how we're considering equity in light of how that field has advanced in the intervening years. So I think, first of all, our methods might be informative to other groups who are interested in undertaking future research on the ETD, as well as some of the conclusions that we highlight in the guidance paper. I hope that answers your question.
I think Paul is next, right?
Yeah, great job, Emily. Yeah, so I'm one of the co-authors on this. I just wanted to return to Hassan's kind of comments because I think there's a few more things going on which are kind of probably explain the, I guess, the priors of our approach compared to, like, say, going down the integrate route or something. So I think one of the things we were keen on was, and maybe differentiates us from other groups developing ETDs, is that we started from the assumption that the GRADE ETD framework approach is basically right rather than basically wrong, and that we therefore adapted to a new context on the assumption that probably most things are right, and therefore it was a matter of modifying rather than trying to create something new from scratch. I mean, I'm not going to try to adjudicate on whether GRADE is right or not, but there's some advantage to creating a new ETD framework, or at least a new version or an adaptation of that framework, with a high degree of interoperability with an existing, well-established, well-grounded framework that makes it then easier to map like things like the differences and the decisions back onto those other ones. You've got some consistency, I think. And I think that meant that it gave us, I suppose, a way of thinking about things like the precautionary principle and how we would modify the existing ETD approaches to accommodate the justified concerns that those principles are not being taken into account in that ETD, and then show how we're doing it in a way that is also consistent with the prior ETD, so people can see that it's an adaptation. We get good acceptance from both sides, I think, is the idea. Now, we haven't tested the acceptance yet, so one of the challenges, of course, of going the existing framework, where most other people are perhaps assuming that the existing framework is not right and that these things need to be done differently, that suggests that there's going to be a barrier to uptake there, because we've very deliberately done things in a pretty similar way. And we're banking on our ability to explain to people that actually we are allowing for precaution, we're allowing for a broader concept of equity and all these sorts of things, which are driving factors in those divergent approaches. But maybe this is, maybe it indicates a little bit of overconfidence on our part or something, but we're going to be able to make that case that actually doing things quite similarly to an established framework is going to be better than trying to do a different framework and then kind of explain how all of that actually works. So whilst we're quite similar in principle to things like Integrate, we only know that because the analysis that we did. And I think we have some advantages over a framework like Integrate for potential uptake. So that was a bit longer than I meant it to be.
There's 1 minute left. I'm just going to make a very quick comment, Emily. I think the area that I think will be most interesting for methodological development in this field will be the overall certainty in evidence, because the simplified approach of just taking the lowest certainty of the lowest outcome, that may work in a clinical context, but here the evidence structure is so complex. You will have ecological evidence, you have observational evidence, you have evidence about values, surveys. So it's a very complex structure. So I think we need some innovation in figuring out the overall certainty in the net benefits of the effect.
Interesting. That's a whole new project.
Yeah, but it's part of the ETD, right? The overall
Yes,
certainty
yes.
is a domain of the ETD, but I think it's very unique here.
I think, yeah.
All right.
Can
Well,
I
I
just-
think
I just wanted to respond, if I may. Sorry, I was meant to put my hand up, but I didn't get there fast enough. I think that's actually also a very interesting area, because we know from the environmental health side that you have, there's a lot more intersecting potential policy options in response, right? And there are a lot of dependencies underneath each of these individual options. So actually kind of systematically accounting for all of the options and all of the dependencies underneath those options is obviously not feasible, but something has to be done to at least make transparent what dependencies or options are on the table, right? So I think it'll do a lot for bringing in transparency and maybe challenging some of the assumptions behind how some of those options even get to the table for evaluation in the first place. But it's going to be very interesting to see how this stuff works in practice on the more open-ended problems. I think one of the really important, was it in Holger's work recently with a few people on, that's about what was called the theory of everything, but has changed its name to something else, where policymakers don't like being given recommendations, they like being given options, and that being kind of a fundamental insight. I think we can roll that very much into our ETD framework and point it at maybe being options rather than recommendations because of the policy environment in which we're going to be applying this. I mean, in some cases it won't really be the same thing as options. We can make recommendations, but getting that clarity will probably be helpful. And that could be some of the driving force behind, say, the feeling that things like grade aren't quite right for an environmental health space because it produces recommendations, and that just sets the wrong tone from the outset. And you could understand why that people would be less receptive if the framing devices and things are off. I know I've said enough now, so over now.
thank you so much, Paul. Great insight. Well, if there are no further questions, I think this is probably a great time to just remind everyone, World Evidence-Based Healthcare Day. You can go to worldebhcday.org for more events and more blog posts. Thank you all for joining. Thank you so much for Emily for that fantastic presentation. Very informative. You'll see this posted to YouTube in the next few days, and then you can go to our YouTube channel to enjoy all of our previous webinars as well. And we hope to see you on Monday, November 4th for our next webinar, and the registration is in the chat here. Thank you again so much for joining us today, and hope you all have a wonderful week.